Hi everyone! Thank you for taking the time to watch this video on the Phase 1 Recovery Pain Screening and Assessment Documentation Expectations. One of the things that I've heard from several nurses since I started here is everyone charts in their own way. And while that may be true that everyone has their own processes when it comes to workflow, we need to make sure that we are all documenting in an accurate, timely, and consistent manner, adhering to both hospital policy as well as regulatory requirements so that we can provide safe and effective patient care. Now this video will be brief. However, the outcomes include reinforcing the Phase 1 recovery documentation expectations so that we're all aware of what those expectations are, describing the process for pain screening and assessment, and then reinforcing UC policy and Joint Commission regulatory expectations for both pain documentation, treatment, and evaluation. Now, when a patient is admitted to PACU directly from the OR, our hospital policy states that we are to assess vital signs every 5 minutes times 3, and then every 15 minutes until the anesthesia discharge criteria is met or the patient has been signed out by anesthesia. Now, these vital signs include their respiratory rate, as well as their oxygen saturation or any kind of oxygen therapy that they're receiving, their blood pressure, heart rate, and cardiac rhythm, the temperature, both on admission as well as when they're discharged from Phase 1, their pain assessment and their POS score, as well as their Aldrete score. The policy also states that we are to perform and document a head-to-toe assessment upon both admission to PACU, as well as when the patient meets Phase 1 discharge criteria, or prior to transfer to Phase 2. Now, I realize that this can be a bit cumbersome, especially for patients who recover from Phase 1 quite quickly. However, the intention, again, is consistency with documentation and patient safety. So the head-to-toe assessment includes their respiratory system, cardiac system, neuro, GI, and GU, their integumentary system, musculoskeletal, any incisions or dressings that they have, any lines, drains, or artificial airways, as well as their intake and output. Now, the Joint Commission has some stipulations when it comes to pain assessment and documentation. We perform pain screenings with our assessment when a patient initially comes into the hospital, either on an outpatient basis, through the emergency room, or through a procedural or inpatient admission to the hospital. Now, if pain is present upon their screening, we then complete a comprehensive assessment. The preferred pain assessment tool here at UC is the numeric rating scale. This is our first line assessment tool. However, depending on the patient's status and cognitive level, we can also use the Wong-Baker FACES as well as the critical care pain observation tool. When a patient does present with acute or chronic pain, we must then perform a comprehensive pain assessment in the EPIC flow sheet. This comprehensive assessment includes both their pain score and goal, the onset, location, and duration of their pain, any characteristics, interventions that are performed, including pharmacologic and non-pharmacologic, their pain site, as well as their sedation level. When providing a pharmacological intervention for a patient's pain, be sure to include at least one pain descriptor, their sedation level score, their POS score, and make sure that we are medicating them within the parameters of that ordered pain medication. In addition to pharmacological administration, the Joint Commission does require that we provide at least one non-pharmacological intervention. So when you are medicating your patient for pain, be sure that you are selecting at least one non-pharmacological intervention from the list in EPIC. When we medicate our patient for pain, we are required to reassess their pain within a certain time frame to determine the effectiveness and the safety of that intervention. For any IV, intramuscular, or subcutaneous medications, reassessment needs to be performed within 15 to 45 minutes of that administration. And for any oral or rectal medications, within 30 to 90 minutes of administration. So make sure that we're getting that documentation in on time. Now, even though we have documented the patient's comprehensive pain assessment, we've documented any interventions, that doesn't mean that we're finished. We now need to document that we've provided education as well as information on the patient's individualized care plan. So to provide education, we're going to go into the Patient Education tab, and we're also going to document in the PNDS Care Plan. Now, additional pain assessment documentation that's needed in the transition from phase 1 to phase 2 or prior to discharge. We need to make sure that when a patient is discharged to the step-down or medical surgical unit, that we document patient verbalizes that pain is tolerable or manageable with or without medication, or they have an absence of any physiological discomfort. And we need to make sure that we're not transferring the patient any earlier than 30 minutes after the last IV dose of pain medication, so that we can ensure that they are in a tolerable level of comfort. Now, when we transfer a patient to same day or to phase 2, we also need to document that the patient verbalized pain is tolerable or manageable with or without medication, and again, that they have an absence of any psychological discomfort. When a patient is discharged to home, again, we need to document that the patient endorses a tolerable amount of pain, and this can all be found in the policy cited below. So looking ahead, we will be conducting some random chart audits to evaluate our charting compliance. The intention of these audits is not to be punitive, but again, to identify compliance and to detect any gaps that we have in our charting. And we will address these gaps with reinforcement of education. If you have any questions, please reach out to myself or reach out to unit leadership. And thank you again for all that you do in providing care for our patients.